Sean bienvenidos nuevamente a este espacio en nuestra página de Sign México. En esta ocasión vamos a tener a la doctora Misha Ashfaq, que nos va a platicar acerca de la educación neuroquirúrgica en Pakistán. De nueva cuenta, agradecemos por parte de Sign México a la sociedad Walter Gandhi y a todos sus capítulos que están participando en este congreso organizado en conjunto con la red PA UNESCO, de la cual el doctor Jorge Herrera Ramos es el embajador y chairman de este congreso. Asimismo, agradecemos nueva cuenta al doctor Salim Abdurov, quien es copresidente de este importante congreso y miembro fundador del Departamento de Cirugía Neurológica en la Universidad de San Luis, Missouri, presidente global de la Walter Gandhi Neurosurgical Society y presidente de la Sociedad para Hipnosis Cerebral y Terapéutica. Asimismo, también agradecemos a la doctora Belenida Capicasillas, quien es presidenta del capítulo ANS-IPN, por su importante colaboración en la realización de este congreso, al doctor Babak Kateb, quien es presidente de la Society for Brain Mapping Therapeutics y es vice-chairman de este congreso mundial. También tenemos al doctor Nasser El Gandour, quien es parte del miembro del comité de honor de este congreso. Es un honor para nosotros estar con todos ustedes. Les doy la palabra a la doctora Natalia Kovacenko, quien va a presentar oficialmente a nuestra ponente.
Yes, thank you, Alejandro. Thank you for the president of Neurological Society in Mexico. So thank you for the nice introduction in Spanish for our Spanish-speaking auditory. So today and tomorrow we have the two final days of the World Congress of Neurosurgery in honor of Professor Yasargil. And it's time to give our young generation speakers to have their word and to do their presentation about the different educations in different countries, especially the neurosurgical education. So first of all, I would like to say a few words to the organizers of the Congress, to Mr. Jorge Herrera, Ambassador of Peace of UNESCO and Chairman of the World Congress of Neurosurgery, as well as to the co-chairman of the World Congress, Professor Salim Abdulrauf, Global President of Dandy Society, and Chief Abdulrauf Institute of Neurosurgery and founding chairman in Department of Neurosurgical Department at St. Louis University. Also to Dr. Deyanira Kapika-Silas, President of WNS, IPAN, and also to Dr. Babak Kateb, President of the Society for Brain Mapping and Therapeutics and Brain Mapping Foundation, and Vice Chairman of the World Congress of Neurosurgery. Also to the honorary chairmen of the Scientific Committee, Professor Nasser El Gandour and Professor Marcus Rota. So we are grateful to all of you and to all of the people behind this for that great event that was pretty long, but I'm sure it was productive and each of our listeners got some information and something important for them. Now we have Dr. Syeda Misha Ashfaq. So she is the president of Walter Dandy Neurosurgical Society in Pakistan. She can seem pretty young girl, but I'm sure she is pretty smart and she's already a medical graduate at Dove Medical College and Dove University of Health Sciences in Karachi, Pakistan. So we will give her the word so she can tell us about neurosurgical education in Pakistan and its alignment with the modern world. So Dr. Syeda, please, can you start your presentation?
Thank you, Natalia, for the kind introduction.
Yes, you are muted yourself.
So thank you for the kind introduction. So as introduced, I'm Syeda Misha Ashfaq. I'm going to be a little bit changed. I'm going to be a medical graduate in a couple of weeks. So I'm almost there. So yes, I'm the president of Walter Reed Andy Society, Pakistan, for students for Pakistan, and we're going to have a chapter established shortly. So since we're all um, it, all of this is in honor for Dr. Ghazi Yasser Gill, and today I'm going to be talking to you all about the neurosurgical education in Pakistan. And throughout this presentation, towards the middle and end of it, we're going to see how much it is aligned with the modern world. So, yes. So, this is Mohammad Yasir Gill. I discovered that he's at an incredible age of 95 years, and that he's dedicated most of his life to neurosurgery, and that is something so inspiring that you give most of your life, a very very big part of it, to neurosurgery, and change the face of neurosurgery, develop new techniques like microsurgery and cerebrovascular surgery, and and that goes without any doubt why he's called the father of modern neurosurgery, right? So just a little bit disclaimer before we get into the presentation, that this presentation is only to improve the current status of neurosurgical education in Pakistan. It's not meant to harm anyone, any person, or any organization or anything like that in any way. So a little bit about myself, that I was going to be an engineer, and I initially thought that medicine was boring because all doctors do is prescribe. But then I watched prescribed medicine. Then I watched the popular ABC's show Grey's Anatomy and discovered that doctors can be surgeon too. So there you know that that's how I got interested into surgery and ultimately to neurosurgery, and that is how I discovered about uh, the the good things and the bad things about the neurosurgical education, uh, the status of neurosurgical education in Pakistan, right? Uh, so um, so yes, this is my college, right? This is where I study. I've spent most of my time here with neurosurgeons up till now. So yeah. So before I talk to you about the neurosurgical education, I just wanted to give you a little bit intro into the neurosurgical care for the people of Pakistan, right? So, what is neurosurgical education? What is the point of it all? Without discussing what is the care we are providing, right? Which means that most of his population is living in poverty, right? Most of it is living in poverty. They're living in rural areas where they don't have uh, developed. Uh, where they don't have tertiary care centers, neurosurgical care centers, right? Where they don't even have basic necessities. Let alone those tertiary care hospitals, right? Neurosurgical care. So what they do is when they have right, so, and that is often they come very late because of that, because there's no tertiary care centers over there in the rural areas, so they come to big cities, and they often come late, which means that for example, if a kid has hydrocephalus, so because he did not have neurosurgical care in his area, so so we all know that going to another city to get treatment is a lengthy process, and it can take time, and for a poor person it can take longer time, right? So obviously they're going to present late. So hydrocephalus is a treatable condition, because of these factors they present very late. So at that time it becomes very it becomes an unsalvageable condition, and the prognosis or prognosis for the kid is poor, right?
Yes, Syeda, you have some connection problems?
Yes, I did. Where did we stop? I didn't even know.
No, just try to move back to the slides and open please your presentation, and you just look where did you stop.
Right. I'll share my screen again.
Yeah, sure.
So we were discussing this that Pakistan is a third world country, and most of the people live in rural. They are poor and they are living in rural areas where there are no tertiary care hospitals with developed neurosurgical care. So most of these people come to the big cities to get their treatment, and they often present late. So they often present at a time when it is not salvageable. But that is one thing about it. But the thing is. Uh, the neurosurgeons are doing a really great job in saving a lot of lives. But there are some other factors that we need to discuss. Okay, so we don't have a very well developed statistic system, but according to one newspaper in 2016, they said that there's one neurosurgeon available for every 700,000 people in Pakistan. And the same newspaper said that only 14 neurosurgeons are being produced each day. So just by that, you can have an idea that uh, that number is not enough to treat the whole population of Pakistan. That is definitely very low, and so the burden increases given that there are no most of the population lives in rural areas and there are no hospitals there, tertiary care hospitals there. So ultimately, they all are coming to the big cities, and all of the neurosurgeons are in the big cities. So they're definitely having a lot of burden on themselves. All right. Uh, so that is one thing that we because we don't have tertiary care hospitals there, so everybody's coming here. No tertiary care hospitals, no neurosurgeons, and everybody's coming to the big cities, right? There are these are few tertiary care hospitals with neurosurgical programs. That is this one right here. This is where my university is affiliated with. This is another big hospital in my city. Another one, and this one is in Peshawar. So I did a last minute research, and I found out that there are only 44 tertiary care hospitals in Pakistan, and each one of them is taking just one neurosurgical resident each year. So what does that mean? That means that they're producing only one neurosurgeon per year. So if we take it this way, there are 44 hospitals and each is producing just one. So there are 44 neurosurgeons. Theoretically, there are 44 neurosurgeons being produced each year, right? And even if it's not 14, like the newspaper said, even if it's 44, it's still not enough for a big country like Pakistan, right? But I think because of lack of statistics, neither the newspaper nor my theory is right, and the number is going to be somewhere in between these two. The number of neurosurgeons is going to be somewhere between 14 to 44 per year, right? So still that is a very low number, right? So what is these neurosurgeons? So what is the neurosurgical education like for these residents? All right. When we talk about a developed country, uh, um, the residents there, developed countries have better developed neurosurgical programs, right? They have their 8 to 9 years of programs, whereas in Pakistan they're only you have to do 2 years of general surgery rotation, and then you do 4 to 5 years of neurosurgical rotation, right? So obviously the programs in the developed countries they're better developed, right? In the developed countries, they have I'd say bigger facilities, like they have like they'll have a different facility for pediatric surgery, a different for cerebrovascular, a different for tumors, and like that. So they have those hospitals, right, where their trainees can rotate and get education, get neurosurgical exposure and education of various subspecialties of neurosurgery, right? So uh, but in Pakistan, it's not like that. You get into one neurosurgical program, right? You don't rotate at any other neurosurgical specialties. You don't have subspecializations in Pakistan. There's no scope of fellowship, right? In Western countries, you would think about doing a fellowship in cerebrovascular or pediatrics or brain tumors, skull based. We don't have that culture over here. You're just a neurosurgeon that has exposure of all cases, or just a little bit of them. Just have exposure to just one kind of neurosurgery, not pediatric, not specifically pediatric, not specifically tumor, or like that. So if you see a case, you see it, otherwise you don't. Schwannomas are really common. I don't want to give that example, but if you see a case of schwannoma, you see it. Otherwise, you're not going to rotate at a facility that is specifically made for to deal with skull-based surgery, right? So you're not going to see um, cases from a specific subspecialty. You see it, you see it. You don't see it, you don't see it, right? So that is one difference. And then in the developed countries, the neurosurgical programs over there, they have simulation labs, right? Where they can where they have models, where they can learn anatomy. Right. Where they can learn anatomy, have operate on those models. Those models, I've seen those models, and they look very real, very very real, right? So they can learn anatomy in a 3D manner, right? And they can build their operating confidence, and obviously they have lesser chance of causing any damage to their patients. And also in their simulation labs, they can use they have all those fancy gadgets. I think the newest one is that VR thing, right? We can't even think of that here. So so in Pakistan, it's like if you the only way you get exposure is by operating on the patient directly, in the presence of your in the presence of your attending. You don't If you read about it beforehand, you read about it. If you go online and search about it, you do that. But there's no proper there are no simulation labs here in Pakistan. That is a much needed thing for both the residents and for medical students, right? So in developed countries, like we talked earlier, they have better developed programs, right? They have subspecialties, and they also have tumor boards. And we don't tumor boards are not very common over here. Some of the hospitals, some of the neurosurgical programs have adopted them. They have kept a day specific for them, but most don't have it. So um, in some hospitals, they're just like they have a morning meeting where they discuss the tumor, and that is that. But we also have one or two neurosurgical programs over here, where they have a day allocated to the tumor board, right? Like they have in the developed countries. All right. So okay, and also in the developed countries, they have in their neurosurgical program, they have many of them have researchers, have dedicated researchers for their residents, right? And the Western world has a culture of research, which I think is very very crucial for the development of any specialty, be it neurosurgery, be it cardiosurgery, be it cardiology, neurology, whatever. Research is pertinent to it, but in Pakistan we don't have a research culture here. If you want to do your research, if you're interested in it, you do it, and there's no dedicated years for it, right? And also in Pakistan, research, I know that it is seen like this in other parts of the world as well. It should not be, but in Pakistan specifically, research is seen as a way to get your promotion. It's not seen something for the development of neurosurgery. It is not seen like you're adding something uh, to the neurosurgical pool, right? Neurosurgical research pool, I would say. It is just seen as a step in your just to get promotions, right? So they're not really focused on it. They should be focused on it because it is very crucial for the development of neurosurgery. Right, and moving on to what is neurosurgical education like for medical students, right? It is not very good for residents, and for medical students it is even worse, right? You walk up to a neurosurgeon, you say that I want to learn about neurosurgery, and they're just going to take you lightly. They're just going to take you lightly, and I understand that there are a lot of factors involved, because they're dealing with all the influx, the big city influx, the small cities, the rural area influx, right? Um, uh, but they really take that mentor-mentee relationship for they don't take it seriously. It is a very minimum importance for them, right? It is very challenging for students here um, to hone their interest in neurosurgery, and I was really sad to learn this, that because of this, because there is no mentor-mentee relationship in Pakistan, many students end up giving up on their dream of becoming a neurosurgeon, and they ultimately pursue something else, right? So, and for women neurosurgeons, there's a trend in Pakistan that patients don't want to be treated by women. They see that their doctor, especially their surgeon, is a female. They say that we don't want to be operated by a female. Right, and that is not only educationally depriving for them, but as they're not getting the exposure, because patients are not letting them examine or operate on them. That is not only educationally depriving them, but it is also setting them back. Right, it is also setting them back in their career when when they're no longer residents, when they're neurosurgeons. That it is also setting them back. So patients do that, and the colleagues, they don't spare you as well. But having said that, there are a lot of colleagues as well, which help women build their career, right? Um, I know many of them personally. So the bottom line is that it is even more challenging for a woman to become a neurosurgeon here, getting a neurosurgical education here. So the conclusion of this is that uh, Pakistan does not have enough neurosurgical programs, right? And lesser number of programs are being produced, and whoever the neurosurgeons are, and most of the neurosurgeons, they come to the big cities, even if they're from small cities. uh, they get into neurosurgical programs in the big cities. They become neurosurgeons, and then they stay in those big cities. So the big cities, although there are not a large number of neurosurgical programs in the big cities, but but all of these neurosurgeons produced from these neurosurgical programs stay in the big cities, and the big cities get saturated with these neurosurgeons. With no neurosurgeons in the rural areas, no neurosurgical programs in the rural areas, and a saturation of neurosurgeons in the big cities, where there are not many hospitals to cater to their what should I say, to their neurosurgical craze. There is no space for them to grow that neurosurgical education or something like that, right? So I would like to say that at this point, this is basically for my country, right? That the neurosurgeons produced over here should go to these rural areas and build programs over there. This way, we will have more programs, we will have more neurosurgeons, right? And the neurosurgical care for these rural area people will also improve, right? And also, when there is lesser saturation in the big cities, then there will be a larger chance, a greater chance um, for the growth of neurosurgery, right? So when there will be a lesser influx of patients in these big cities, so the neurosurgeons will not be. They can now focus on developing subspecialty programs, right? They can focus on developing a skull-based facility, a pediatric facility, and things like that, right? And having tumor boards, and so I really think that developing neurosurgical programs in rural areas can really help in the development and neurosurgical education improvement in Pakistan. That can also apply to, I think, other countries as well, other developing countries as well. But that is that from my side. Thank you very much.
Thank you very much, Dr. Syeda, for such a great panorama of how to be a lead neurosurgical trainer. Um, Dr. Natalia, would you like to say something?
Yes, thank you, Alejandro. Thank you, Syeda, for your view on the problem, because like I'm originally from Ukraine, and actually I'm in Ukraine, and it's also the developing country, so I can understand this, especially in terms of such education as neurosurgical. And yeah, that's something that should be well known and shared through people, through doctors, and that's something what have to be looked at and discovered, and like to pay attention. People and government and doctors and medical schools should pay attention to this, to develop this, so to build the good background for the future people who would like to become neurosurgeons or any other doctors. So okay, next, what is next? Who is going to give the presentation after Dr. Syeda, Misha?